We welcome Dr. Chris Sanborn to our program today. He is a bariatric surgeon with the Surgical Weight Loss Center at Erlanger Medical Center, and he's here to discuss Erlanger's programs. I guess the first, welcome. Good to have you to Chattanooga. What is this, and who would have it done and why?
Sure. Bariatric surgery refers to a group of surgeries that help us with weight loss. We always talk about diet and exercise as a means to weight loss, but unfortunately that's ineffective for most people. So we provide a tool with these weight loss surgeries. And the surgeries are the gastric bypass, that you may have heard of, the laparoscopic adjustable gastric banding, and then the gastric sleeve resection is one of the newer ones. These all modify the stomach in some way, and some of those will also modify the intestines to help us achieve those goals of decreasing those calories in and achieve the weight loss.
Is this recommended, or can everyone be a candidate for that, or are there certain people who can't for one reason or another?
Right. There's a lot of people who would be candidates, but there's also a lot of people who wouldn't. So we have a very careful screening process to identify those patients. A lot of people will choose to look at bariatric surgery or weight loss surgery because they're having problems associated with the obesity itself. Diabetes, high blood pressure, high cholesterol, osteoarthritis, pain in the joints, those kind of things. Those will lead them to it. Some people, the lifestyle limitations of the obesity are enough that make those people interested in the bariatric surgery. But we look at the severely obese patients, and one of the newer terms that's been around a while but now is a little bit more in the media is the BMI, the body mass index. So that's just a fancy way of really relating the patient's height to their weight. And so the BMI, we take a BMI of 25 or better, that's really that's overweight. And if you get 30 or better, it's obese. And that's about 30% of our country. So you know from there, there's probably going to be some surgical candidates in that group because, like I said, the non-surgical weight loss methods aren't working for everybody. But we look at 35 and above. So we're a little bit more severely obese patients that are BMI 35 and above with problems. And some of the patients are BMI 40 and above. And alone, that will justify the surgery in some patients.
Is there any one thing that causes a person who's obese? It seems like they can't lose weight.
Right. You would think, and like I said, you talk about calories in and calories out. Eat less, exercise more. Sounds simple, but the reality is it's extremely difficult to achieve. Even in medically supervised programs and with diet and exercise, only about 1 in 20 patients will achieve their weight loss and keep it off that way. Obesity really is a disease. It's not just a character flaw. There's a lot of different causes, whether they're hormonal, genetic, psychosocial problems. But one of the best ways to understand it is to look at it as the body's got a set point. Just like we got a thermostat in our brain that tells us it's too hot, we need to sweat and get the temperature down, it's too cold when we shiver. We also have a set point for weight. Very easy to elevate that, very difficult to get it down. And that's the problem we're dealing with. So once you start dieting, and you're not taking in the calories to sustain that weight, your brain kicks into starvation mode, and it's really hard to stay on a diet at that point.
And I'm imagining you have quite a few programs because everybody's different as far as helping them, right? Right,
we do. At Erlanger, we have not just surgical weight loss, but we also have non-surgical weight loss. We have the Lifestyle Center. It's located downtown. It's a pretty convenient location, get everybody there. And we have a full complement of professionals there. We have a dietitian, we have exercise physiologists, we have psychologists, all of which help us assess the patients for surgery, also deal with patients for the non-surgical weight loss. And then we use those professionals to provide long-term support afterwards, including weekly support groups. And
we have a number of things that are listed here that tell the dates that some of these programs are going to be taught and where and the time and all. And you can check our website, newschannel9.com, and write them all down and have plenty of time to study them. Doctor, thank you. Come back to see us. We appreciate it very much.
Thank you very much.
Now we're going to join Mr. Food in the kitchen. Guess what? It's time for Down Home Ribs.